Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome to the LowCarbMD podcast. Tro, we've done it again. Good to see you, man.
Yeah, listen, I'm excited about this one. Very interesting journey. Another healthcare professional taking her health into her own hands. Super excited about this one.
Yeah, we were working on introducing her. She's done so much stuff, Tro. Let's let her introduce herself because, I'm blown away. It's pretty awesome. So, Nevada Gray, welcome. The Paleo Pharmacist.
Thank
We
you
love
so
your
much.
stuff on Twitter. Thanks for joining us. Tell us your story.
Thank you guys so much for having me here. It's a pleasure. I've been following you guys on Twitter. I've learned so much from you. So thank you for all the great content you're putting out there. So my story actually started when I was a kid. I was someone that had chronic allergies and asthma. I was allergic to a ton of foods. I was always in the doctor's office for allergy and asthma, trying to figure out what can I eat. I was allergic to pollens. So there were cross reactors with fruits and vegetables. So we had to cook the food. My sister struggled with allergies too. So my mom was always trying to figure out, well, what can I feed my kids? So we ended up growing up on a processed diet, and that led to several problems for me. I developed PCOS in my teen years and early 20s. So I started struggling with metabolic problems and obesity. So I thought, I'm just going to go to school and study science because I'm a natural science geek. I'm going to study science. I'm going to find a career in healthcare that I enjoy, where I can figure out how to help myself and then help other people navigate these issues in health. So I started going to school. My first degree was in biology and chemistry. I did a pre-med track, and I started learning about the biochemistry of the body and how things worked, anatomy and physiology. Then my natural next step was I thought I wanted to go to medical school, but I waited because something in me paused. So I worked for a drug manufacturing company. I worked on several medications for neurodegenerative conditions such as MS. And then I had a chance to go to nursing school. So I thought, well, this would be a good choice for me. And then I can decide if medicine is something that I want to work in or if I want to go more the research route. So I started nursing school, and there was a nutrition class, and I thought, this is fantastic. I'm getting all this insider information. I can fix myself, and then I'm good to go, to help other people in practice. So I started applying what I was learning, and long story short, I just kept getting sicker and sicker. I continuously gained weight. My PCOS got worse. So I started working out in the gym. I was going to the gym 1 to 2 hours a day. I joined my YMCA, and I thought, well, I just have to get myself moving and, continue to do this. I was mostly still following a high carbohydrate diet with introducing foods I was not allergic to. I was starting to have some trouble with gluten. I was learning about gluten. And my allergist thought, well, you could be allergic to that. So I started adding in all the gluten-free breads that I could find and, highly processed foods while still trying to cook fruits and vegetables and deal with that whole nightmare. So I, continued to gain weight, and I thought, okay, next step is the gym. So I worked in practice in neuroscience, and I just continued to get sicker and sicker, not feeling well. I would go every year for my physical, and I would be up another 10 pounds. My doctor would tell me, just work on your diet, go to the gym, everything's going to be great. You got this, you can do this. And I'm thinking to myself, I'm already doing all these things. So I started reading up on PCOS, seeing whispers of insulin resistance, because at the time, 20 years ago in my 20s, there wasn't really a lot of information on it. So I had discovered Dr. Atkins. I did the Atkins diet for a year, got a great result. And when my primary care saw that I was doing this diet, he said, oh no, this is a dangerous diet. You don't want to keep doing this diet. But I was feeling good because I was eating more protein, all the cheeseburgers and everything. I'm like, this is, great. I feel great. I lost some weight. So I stopped doing that. And then I went to pharmacy school, again, had another nutrition class and thought, okay, I'm just going to continue this. And by the time I graduated pharmacy school, I weighed 220 pounds. I'm only 5'4". So I was quite obese. I had obesity written in my medical chart that year on my physical. And I was also told I was pre-diabetic, heading towards diabetes, and I needed to get control of my health. So at this point, I was very frustrated. I felt like a failure because I'm like, how can I help my patients when I can't even help myself? I'm, just getting fatter and sicker. I was starting to feel depressed. I'm like, what am I doing wrong? So I went and I hired a personal trainer, and I started working even harder in the gym. I also discovered the paleo diet. So I thought, okay, this might be my next step. So I started the paleo diet.
Wait, can I come ask a quick question? I know,
Sure.
oh my God, all the listeners are going to be like, Tro, you're
Oh, Tro, you did it, man. You did it, man.
I know it's not Brian, it was me. So, okay, so here you are, brilliant person, nursing degree, neuroscience research background, going to your doctor regularly, getting advice, reading the literature, doing, trying to find something, eating fruits and vegetables, going to the gym, personal trainer, and no success.
No success at all. I was so discouraged. I actually cried, and I'm not a crier, but at that moment after that doctor's appointment, I remember going out to my car and crying so hard because I was so frustrated.
I mean, and that's just does that not describe every single person you see, Brian? Like we were all that person.
It's tragic.
Right?
We were all that same person. I was exercising 6 days a week, eating the healthy stuff, and I was getting worse. And it is very frustrating because you're doing it. And your doctor's thinking, okay, you're eating Twinkies behind my back. You're doing wrong stuff. Because a lot of the doctors have never struggled with weight, so they don't understand the struggle that people have. And someone like you who's smart, obviously it's not because people are dumb and lazy, and like you prove all those points wrong. So this is for doctors out there who are judging their patients, saying, hey, look, people are doing all the right stuff, quote right stuff, air quote right stuff, but they're not getting better. And we keep giving them the same advice: just exercise more. Well, you're exercising a lot, a ton, and so then you end up injuring yourself, it sounds like.
Yes. So what ended up happening was with the paleo diet, I started introducing more protein. So I was eating more chicken, which is what I thought I had to eat, turkey, leaner cut meats, because I was still under the impression I had to do the low fat. I was also still doing the gluten-free pasta, cooking the vegetables that I could tolerate. Fruits I've always had a problem with because it would cause angioedema around my lips and my throat due to that oral allergy syndrome. So despite cooking and all that, I tended to avoid fruits. So I was still, fairly high carbohydrate type diet, but it was, more adding in more proteins. And I ended up losing about 50 pounds, but that was really hard to do because I was training so hard at the gym. At this point, I was doing 2-a-days. I would go in the morning and do my cardio, and then I would meet my trainer after work, and I would be doing the weights. So my life revolved around this. I had a container system of meal prep because I thought I had to eat every 2 hours, like I was reading an Oxygen magazine. So I walked around, I had this big bag, it was like a suitcase, I had all my containers in it, and I thought I had to eat. I was never satisfied in my hunger, and I think in hindsight, looking back, I was just so hungry for nutrients that I was just eating, trying to obtain what my body needed for energy and fuel. I was always feeling tired. And then I started to develop back pain. And what happened with that was I ended up contracting mono, which kind of catapulted where my back pain happened. So as a person that would just go once a year for my physical, that was, I was that type of patient. I developed a fever one day, and I just progressively started not feeling good throughout the course of the day. And I noticed my glands were swelling. The glands in my armpits were swelling. I had a really bad headache. So I actually went to an emergency room, which was one of my first non-allergy, non-anaphylaxis emergency room visits. And they thought I had meningitis. So I had a spinal tap to rule that out. And I ended up developing a leak because the Durator. So to correct that, I had a blood patch done, and that was done in my lumbar spine. And after that, I developed back pain that would not go away. I was also training at the gym once it was safe to do that. And I was fatigued from having the mono diagnosis that was going on for a few months. I don't know where I caught that. I was in my 30s at the time, which was quite an experience. And then I was still training, and I just developed this back pain. It wouldn't go away. It would wax and wane. It kept getting worse. And my doctor put me in physical therapy for a while, which helped. And then the back pain just started getting unrelenting. So at this point, I started using lidocaine patches. I was taking ibuprofen every day. I was still working out at the gym, trying to lose weight, still following the paleo diet. And one day at work, and a few weeks prior, I started having trouble going to the bathroom. So I called my doctor. I'm like, I'm having trouble going to the bathroom. I don't know if I have a urinary tract infection. And I went in, he said, nope, everything's fine. All the test results fine. And I'm like, I'm still having, this back pain. Could it be connected? And he's like, no. He's like, everybody has back pain. Just use the patch, use the ibuprofen. So I'm still continuing to do this. And I was at work one day, and all of a sudden I started to develop these really bad pain in my hip, and it was shooting down my leg as sciatica, and it went all the way down my leg to my ankle. And the pain just kept getting worse and worse. I'm like, oh my goodness, this is like the worst pain I've had. And I recognize this is, probably sciatica. I noticed my foot was getting a little lazy, and I'm thinking, oh great, now I have sciatica. So I had one more day to work, and I thought, I'm going to go to my doctor and figure out what is going on with this back pain. This is ridiculous. So by the end of my shift, I actually had to use a motorized car, because I work in a community pharmacy, motorized cart, to get out to my car. I drove myself home. I walked up the stairs to my apartment, and I'm just like, okay, I'm going to go to bed. I'm going to get through tomorrow, and I'm going to figure out what's going on. The next morning, I woke up and I tried to get out of bed, and I fell, and I realized I was incontinent of my bladder, and that I could not really feel from my waist down. My feet were not working. I could not get up. I was in the worst pain I had ever felt in my life. And I realized at that point, working in healthcare, I was in an emergency situation, and I didn't think my community hospital could handle this. So I started calling everybody in my telephone. And finally, a friend picked up it, and I said, please come to my home and take me to the highest level medical center. Because if an ambulance came, they would just take me to the community hospital, which was closer. So the highest level medical center was about 20 minutes away from my home. And I explained what was happening. So my friend rushed over. It took forever to get me in the car because I could not walk. So my friend had to carry me down 3 flights of stairs and get me in the car, which was a nightmare in itself. So she had me flat in the car, and we just rushed to the hospital. The paramedics had to get me out of the car at the emergency room because I could not get out of the car. And the emergency room doctor, by the grace of God, recognized that there was something drastically wrong with my spinal cord. So I was quickly triaged and taken up for an emergency MRI. And that's when they realized that I had a massive central disc herniation in my lumbar spine at my L5S1 that was crushing multiple nerve roots in my Cauda Equina.
Guys, I wanna pause right here, and I wanna talk a little bit about Cauda Equina and what it is, so the average listener can kind of get a sense of this. Certainly the doctors listening will know. Basically, it's a spinal cord injury. The spinal cord sends all the nerves to all the different parts of the body. And when there is an insult to the spinal cord, certainly you can have progressive weakness, you can have progressive numbness. And one of the telltale signs of a very severe spinal cord injury is loss of bladder or bowel function. And actually the first sign is urinary retention. So imagine you have a disc that's about to, push on the spinal cord. You may first feel, pain, then it'll be, numbness and weakness, just like you have right here. And then it's, oh my God, I'm retaining urine, and you're incontinent because of that urinary retention, or you have fecal incontinence because those nerves are damaged and they're blocked. And and you lose that function. So this is an emergency. You know, if you have a little bit of sciatica where you have pain shooting down the leg, that's not an emergency, right? But the minute you have an insult to the cord, which clinically we diagnose by that loss of bladder or bowel or bladder function, or by progressive weakness, that's an emergency. So this is like, and time is tissue at that point, right? The more you have pressure on that nerve, the more insult you have, and the more chance, you know, the longer you wait, the harder the recovery. So this is a serious situation. I mean, I would have been terrified. And like, here you are, you're like, I can't even call the ambulance. I have to get to a higher, I mean, so this is, you know, this is scary.
Yeah.
It was
Cauda Equina,
absolutely terrifying. Absolutely terrifying. Yes, because what I felt in some of the red flags and hallmarks of it is you have saddle anesthesia. And in my case, I lost the sensation of my bladder. I didn't feel it. So my bladder, the whole previous day, was just retaining urine to the point where I was having the overflow incontinence. So I had loss of that bladder function, which in hindsight, I was told was kind of a poor prognosis, that it had progressed versus having it incomplete where you could still urinate. And I realized I really hadn't urinated the whole day prior because I just lost the sensation of it. So what I felt was just from the waist down, I could feel myself becoming paralyzed. It was almost like a limb would go to sleep, and it was just getting more and more painful. And my right leg was severely affected. My left leg was starting to become affected, and you lose reflexes. So you have absent reflexes. So the reflexes I was supposed to have there were not there. And I could feel, so attached to the nerve roots are dermatomes, so areas on the skin and areas of the leg as you progress down. And I could feel along those dermatomes loss of motor and sensation happening. And it's one of the most painful things you'll ever experience. I actually accepted morphine for the first time ever in my life when they offered it to me. And I just honestly wanted to be knocked out. I was in so much pain. And my surgery, the critical window is actually 24 to 48 hours, but you want to have that surgery immediately as soon as there's a skilled neurosurgeon available.
You also want steroids right away. Steroids and surgery to decrease that inflammation.
Yes.
In the spinal cord, and you want decompression and surgery to correct the issue. So what, I mean, we know the outcome is good. So I'm wondering what happens next.
So I had my surgery around I calculated around the 36 to 38 hour mark after the acute symptoms. So my neurosurgeon did a microdiscectomy because my spinal cord looked so good. He didn't want to do anything to destabilize it. So no laminectomy, nothing. He just went in and he meticulously there were multiple disc pieces. He took whatever he could off the critical areas safely. And I was brought up to a hospital room. Immediately I had relief of pain. So I was pain-free, which I was very grateful for. My left leg came back, which I was very grateful for. My right leg was severely affected with motor and sensory problems. I had foot drop, and I really just couldn't feel my leg. It was just so weak. I felt weakness from the waist down. My bowel was never affected, which I'm grateful for. My bladder ended up coming back throughout the course of the week, but I had to really work on in physical therapy, bladder therapy, because it takes time. This isn't an overnight process. It takes time for the nerves to work out the injury. I had high dose steroids after my surgery. So I was in the hospital for about a week and a half. They wanted to make sure I could urinate.
Hold on, can we pause it a little bit? High dose steroids. Okay. So great way to cause insulin resistance. How was your blood sugar after you're on those high dose steroids?
I'm not quite sure, but I did feel high as a kite. I will tell you that.
Yeah.
I felt high as a kite, and I wasn't really very hungry after my surgery, so I wasn't really eating. And then a diet order wasn't put in for me right away. So besides the high dose steroids and the fluids, I was essentially fasting.
Right.
So after this happened, I was exhausted. a fatigue I never really felt before, and I just wasn't hungry. I wasn't eating anything. So by the time I got discharged home, and I wanted to go home because I felt that I could just heal in my home. So I asked the physical therapist, what tests do I have to pass so I can get discharged home instead of having to go to a rehab facility? And she said, you just have to be able to do these 3 things and we can get you home. So I'm like, okay. So by the grace of God, I was able to do those 3 things. So I was discharged home with services. So I went home.
And how long ago was that? Sorry, how long ago was that?
This happened in January of 2016.
Okay, so this is about 5 years ago.
And
About
I'm curious,
coming up on 5 years.
I'm curious, what was your weight at that time? Had you come down from that 220 by the time this happened, or were you still?
Yeah, I had lost 50 pounds from that. So I was around, I want to say I was treading between, like my weight would always be fluctuating between the 170s and 190s. So I was always.
But now I'm sure exercise is going to be really, really tough. You were spending all that time in the gym. So major life change, right? Right
Yes.
there, you know, all that exercise out and calories out, right? Which they emphasize. So what happens with your recovery here? And what role does diet play in that recovery?
It played a huge role. So I was discharged home. I had home services. I had a lot of help. My mom had to come over every single day to set my apartment up. My apartment was set up as if, you know, for a handicapped person. I had shower chair. I had, you know, commode over the toilet, everything that you would take for granted. You know, all the things you're able to do. I couldn't shower by myself. It was everything you take for granted for quality of life. I had taken from me. I felt so out of control of my body. So I had a home physical therapist. I had an aide. I had my mom coming over every day to help me. And when I finally got home and I could take a breath, I Googled my condition, which was against my neurosurgeon's advice, because when I woke up from my surgery, the first thing he told me was, I believe you can have a full recovery. It's going to be the hardest thing you can do, but I think a recovery is possible. And he's like, that's what we're going to go for. So I'm like, okay. I'm like, I can recover from this. So he gave me encouragement. So I went home and I Googled my condition, which he told me not to do. And that's when I flipped out because I didn't see a lot of people recovering. I looked in the literature. Patients weren't followed past 2 years. There was really nothing. So I didn't know what to expect. There was no protocol. I didn't know what to do because part of feeling in control is knowing what to do and having information so you understand all this.
And support.
You
know, that's the big thing, right? Well, what do I eat? What do I exercise? How long will it take?
How do I fix this?
How do I fix this? What can I do? And we see this after stroke too. We see this after a lot of neurologic issues, MS, where people ask us, well, what diet do I do? What, you know, and you worked in MS. So what do I do? What diet do I do? What do I eat? How do I exercise? How long will it take? So I'm sure the questions are swirling. And then I know if you go to the literature, there's now probably then there wasn't a lot of data on spinal cord injury and diet, but certainly there's been some data since then.
There's been a lot of data since then, which I'm very grateful for. And there's also clinical trials in the works as well, which I'm very grateful for that this is being researched. So after I Googled my condition, I paged my neurosurgeon. I had a page at the hospital and I asked him honestly, I said, am I going to recover from this? I let him know what I was reading. And I said, I'm honestly having a panic attack. And as someone that, doesn't have daily anxiety, this is quite uncomfortable. I'm like, I need to know these answers. I need to know the truth. And he said, no, I believe you can have full recovery. Stay off of Google, stay out of the support groups. You're not going to see a lot of positivity. Just focus on your physical therapy. And it's going to be hard because when peripheral nerves are damaged, it's more forgiving than when the actual spinal cord is damaged because the Cauda Equina is peripheral nerves. So my injury was ischemic. And there's several different classifications based on nerve injury. And depending on what's still intact of the nerve, these nerves can regenerate themselves. So he told me that the nerves may regenerate around the injury, or when things settle down, the nerves will start working properly. So over time, you will get sensory and motor. and we're just going to go for full recovery and whatever we can get back. So he focused me on being able to recover from this and knowing that the peripheral nerves were capable of the regeneration and that was possible. It's usually 1 millimeter to 5 millimeters a day, depending on the type of injury and what's intact. And some people don't recover. That's a fact of the situation. So I knew that going in, but I said, okay, I'm just going to go, for the full recovery. So I was still discouraged. And
can I pause right here a little bit?
Sure.
Brian, how many times have you heard diabetic peripheral neuropathy is an irreversible, issue, or nerve injuries are an irreversible issue? And yet, we even had somebody on the podcast, I think it was Brenda Zorn, who said, it took her about 2 years and the pain was gone, her sensation was back. How often, I've seen diabetic peripheral neuropathy reversal. I've seen it.
I haven't just heard it. I've said it. I said, once you get it, you're done. I mean, my whole role was prevention. Now we're seeing people saying, remember that burning in my feet is getting better. So I'll take it. I mean, it's pretty awesome. And it may take a long time because you got to go all the way to the bottom of your feet. That's we're talking like, what's the term? Like a millimeter a week or something crazy. Like
millimeter a day, right?
Millimeter a day. That's like,
Yeah, so it took about 2 years total. So how I found ways to optimize that was I went on Google after speaking with a friend after being, discouraged. And she said, go on Google, go on YouTube, find people that beat the odds and encourage yourself because you're going to beat the odds. So I thought that's a great idea. So I went on YouTube. The first person I actually found was Sean Stevenson, who reversed his degenerative disc and spine disease with fitness and nutrition. And he's actually the host of the Model Health Show. So I found him, and that's what got me on social media. I created an Instagram account to get in touch with him. And he told me, I just developed a protocol based on what I was reading. And, you should do that too. He sent me some podcast interviews that he had given about how he did that. So that's what I decided I'm going to do. I'm going to develop my own protocol. I'm going to research. I'm going to learn everything I can about Cauda Equina Syndrome and nerve injury and see what happens. The next thing I found was ketogenic diet. So I found multiple patients with stage 4 cancers and glioblastoma that was doing the ketogenic diet. I remembered learning about the ketogenic diet as part of standard of care for epilepsy. So I was familiar with it in neurologic conditions. There was nothing on the ketogenic diet with Cauda Equina Syndrome. So what I did was I started extrapolating data and applying it to myself. And I saw that injured nerves can have altered glucose metabolism. So I started theorizing, well, if my injury is ischemic, maybe the metabolism of these nerves is not working and I can give this an alternate fuel source. So I started the ketogenic diet. I found my friend Vanessa Spina, who's the ketogenic girl, who taught me how to do a well-formulated ketogenic diet because I was doing
What year was that? Sorry, what year?
Oh, 2016, right after my injury.
Good.
Yeah,
Okay.
within weeks of getting home from my injury, I did this. So she had a meal plan that was based on the classic ketogenic diet. So I learned how to do this diet. I was measuring everything. I bought a meter. I was making sure I was in nutritional ketosis. The scientists at ICORD had some studies out with cervical injury showing that ketosis lessened the lesion and improved forelimb motor function in mouse studies. So I thought, okay, there might be something here. There's improvement in epilepsy. I started connecting with other people in the ketogenic diet space with neurologic injuries that said, yes, I found improvement with this. It takes time. And my neurosurgeon had already prepared me that this could be a 1 to 2 year recovery. So I knew it was going to take time. So I thought, okay, I have nothing to lose by trying this. So I just started researching all of the science and implementing this diet. So for the first year, I did a classic ketogenic diet. One thing that when I would cheat on this diet, and yes, I did cheat, I would cheat with protein because I wasn't getting enough protein. So I would cheat with a steak. And sometimes I would eat 2 steaks. Sometimes I would eat multiple hamburgers because I just...
Sounds like a good cheat meal to me, Brian. I don't know.
Man, I'll take that any day. Yeah. Because you like, just to clarify, you were doing a classic ketogenic diet as we would for epilepsy. So that's a really high fat ketogenic diet.
Yes, it was.
And so that I think that's a great point, because a lot of us are kind of like, I'm more of the Ted Naiman school of thought. And now I'm starting to think back the other way, because I'm seeing some patients do some remarkable things, adding fat back to their diet. So I'm really curious to see, not only from your recovery, but also weight-wise, what was happening, because you're on a really high saturated fat diet. What happened to your weight during this time and your recovery?
Yeah, and you're not exercising. All that fat and no exercise. You
Yeah,
must
exactly
be
the
gaining weight
point.
right now.
Well, I was exercising because I was in physical therapy. So my physical therapy was based on the work of Dr. Stuart McGill. So anyone that has back problems, Back Mechanic is the book for the layperson. He extensively studied the spine, and he's the father of functional fitness. So my entire rehabilitation was based on this. So I was doing PT every day to strengthen my core and glutes, to stabilize my lumbar spine, and to rebuild myself, correct muscle imbalances. So over the course of a year, things came back. And over the course of the year, I lost weight. I was then down, I think my weight was like around 160. So I was in the 160s, which was my lowest weight in a long time. I was getting stronger. The only thing that did not come back was I couldn't really feel my right foot on the ground. I had lost sensation. There was like a little quarter size area on my heel, and that's how I knew my foot was on the ground. I had inserts to keep my foot in the up position. My foot drop was resolving. I was able to walk. I had progressed through the devices of the walker and the cane and all that stuff. And I was able to walk. I returned to work. I was able to stand, do my job, and just built myself up from there. So over that course, I was doing the physical therapy and that training. I was walking every day because after back surgery, physical therapy is essential. And most people get 8 to 12 weeks tops. You just have to continue that after for a successful back surgery. You have to correct those muscle imbalances and stabilize that spine the best you can. So that's what I worked on. I also had mindset work that I did. I visualized, did a lot of visualization. So that was a huge component. I found Dr. Joe Dispenza, who recovered from a spine injury. He's big into quantum mechanics and healing. So I instituted that. And then my dietary component was a series of accidental discoveries after that. So with my diet, I was quietly cheating with this protein, and I would go days without eating vegetable. I would just do the fat and the animal. And I would meticulously check myself because I would be nervous that I was not in that therapeutic ketosis, and I was always in ketosis. And I noticed my ketones did start to go down, my blood sugar started to go down, and I learned from experts in the space that my body was becoming better fat adapted, and that was a common finding. So I felt comfortable with that. Around that time, I discovered Dr. Georgia Ede, her food blog, and started hearing whispers about a carnivore diet. So Sean Baker, started to hear about him. I saw a podcast with him, and I thought, okay, I'm going to, try this and see what happens. I found the work of Dr. Sophia Clemens from the Paleo Medicina group. They had the PKD protocol,
what year was that? What year?
This was going into 2017, probably around mid 2017.
So about a year and a half after kind of like the initial neurologic insult.
Yes.
Okay.
So the dates and everything kind of blur, but it was around, I did the keto for like around a year and a half. And that's when I started discovering and finding people doing the zero carbohydrate. There was, Dr. Sophia Clemens. I was just starting to find, it was hard to find the literature and hard to find the people, but I started to just find things. And one thing was leading to another. And I found these people that had eaten a carbohydrate in a decade through the zero carb space and were healing themselves from all this autoimmune allergy. I was just reading their stories, and I realized from a nutrition textbook that carbohydrates are an essential nutrient. So I'm getting more comfortable because in doing anything for my health, because of the way I was trained so classically, I wanted to have confidence in this, that I was doing the right thing. I wasn't going to hurt myself. So I just started reading, and I just went into a zero carbohydrate diet and just started following a zero carbohydrate diet, up my protein, because at that point I had learned from the Emmerichs that I could also leverage my own body fat that I still had to lose, because I still wanted to get this weight off me because it was, impacting my back. So I started upping my protein and decreasing slightly my dietary fat. And that's when everything just started changing for me. I started losing weight. My body composition improved. The neurologic pain flare-ups that I was having disappeared. The spasticity improved. My upset stomach when I would eat vegetables improved. My eczema started going away. My skin was looking better. I noticed I was sleeping better.
I got a question.
Yep.
What was happening to your LDL as you lost weight and went zero carb?
So,
because you're a good patient, right?
Yes.
So you're a good patient, and you probably went to the doctor, and you probably saw this. And just so you know, there's data in the literature that in diabetic peripheral neuropathy, for example, the higher your LDL, by MRI findings, the more likely of a chance of improved symptoms, or at least the association of improved symptoms. The higher the LDL in MS and spinal cord, there's associations with improved neurologic recovery. Certainly there's some evidence showing that in MS, and Walls has done this, Terry Walls, and in MS and spinal cord injury, that lower carbohydrate, higher fat diets seem to, at least seem to be associated with some improved findings. So I'm just curious, all these things get better. What's happening with your cholesterol?
My cholesterol was slightly elevated, Dr. Tro. My LDL was high, but my triglyceride HDL ratio was really good. And I became comfortable with my LDL being high because I found the work of Dr. Nadir Ali and Dave Feldman. So understanding some of the mechanisms, I shared this with my doctor. I was no longer pre-diabetic. My metabolic markers improved, my blood pressure improved, my weight improved. And at the 2-year mark, at this point, I had been about zero carb for 6 months. I went for an ultrasound for my annual women's exam, and I didn't have any cysts on my ovaries, which was like one of the first times in my life that I didn't have any cysts, because I was so busy learning how to walk again and worried about that I completely forgot about the PCOS and obesity that I was just, trying to fix my whole life. So that was in remission. The symptoms that go along with PCOS, the cosmetic issues, the skin tags, the hirsutism, all that was improving for me. That cystic acne I had was improving. So I felt good. I felt like I was looking better. People were asking me what I was doing because, that was probably the best people I've ever seen me look and feel, despite being, an even keel happy person. People were asking me, what are you doing? This is like this transformation. My mom started a ketogenic diet. She went zero carb for a while with great health results. In her 70s, she lost 40 pounds. She's got a bicep. She started reversing her osteoporosis. She got off all medications. The people around me just started really embracing and learning about this. And improving their health as well. So I was doing this, in a community among friends and family as well.
Oh my
So
God,
can I ask you a question?
No, throw my turn, man. Let the West Coast guy just ask a couple of questions.
All right.
So I'm really curious about this. So basically what you did, and this is my thinking, you went on a high fat ketogenic diet, switched over to more of a carnivore type diet. You lost more weight on the more lean protein. It's how, proportionally more lean protein. So what I'm thinking is that both sides are right. I'm thinking some people, and I'm curious about what your hunger did during this time and what your mood did during this time. Because the thing I've been so intrigued by is I see people go carnivore, their mood gets better. There's no doubt about that in my mind just from me clinically seeing this. And also from a weight loss perspective, I think at first when Tro said this, I kind of shook my head and go, this guy's kind of nutty, but he's right. I think initially people going on a higher fat diet, and then we start tapering that fat down and let them, once their body's used to burning that fat, and there's theories out there with regard to linoleic acid and stearic acid, maybe changing that ratio, right? And then cutting that fat down and then letting your body burn its own fat. That may be something that is a brilliant step, possibly, theoretically. So I'm curious what happened with you mood wise and weight wise with these changes.
So weight-wise, I got down to the leanest weight I've ever been with the carnivore diet. I was 127 pounds. My body composition was really good. I was lifting weights. I was still doing my cardio routine because walking keeps me back pain free. It's nature's back bomb. So I would walk, I would run. I'm now into cycling.
I love that. Did you hear that? Walking is nature's back bomb. I love it. I'm going to steal that one.
That's actually from Dr. Stuart McGill.
Okay, perfect. Got it. Okay.
So I was still doing that, very active. And I got down to my leanest weight. And my mistake that I made about a year ago after doing this, for almost 3 years, I started not feeling well. And I just, my eczema was coming back. I was having some hair loss. I, just was not feeling well. And I felt like I was missing something. So I went to see an allergist because I thought, well, could I add some foods back in? Because up until that point, I was doing amazing. My mood was really good. I've always been an even keel, happy person, but I was feeling really good. Overall, I'd wake up every day. I was sleeping great. Just had an overall really good outlook on life. My allergies had improved. My seasonal allergies, I still had them, but they had improved. My eczema improved. I hadn't had to use an asthma inhaler, that whole time. So my PCOS improved. I just felt like I looked and felt my best at that point. And then something just happened where I started not feel good. I think my mistake was I needed to flip that lever again with the macros, and not knowing at the time, when you look back in hindsight, when you know better, you can do better. So I went to see an allergist to see, well, what can I add back in? And I had extensive allergy testing. And I started to add some foods back in. And I actually discovered Dr. Ted Naiman. I read his book, The PE Diet. And I thought, well, I think this is the natural next progression for me in my, dietary choice. And I did check to see, am I still fat adapted, adding these back in. And my blood sugar has still been good. I have a keto mojo meter, so I measure everything. My blood sugar was still good. My ketone level was still, baseline for what it had been when I was doing the carnivore diet. So I started adding foods back in one at a time with the help of an allergist to have more variety. And what that was kind of shaping into was what Dr. Naiman has for the PE diet, the higher protein energy ratio. And I realized this is satisfying my hunger. So I started to add in seafood was the first thing I added in. So I could get more micronutrient, have a better micronutrient profile. Because mostly what I was eating on carnivore was steak and eggs. So I was mostly eating steak and eggs. I wasn't really eating a lot of seafood. I would have some salmon and salmon roe occasionally. I was doing bone broth. But that was primarily what I was eating for 3 years.
I'm going to jump in here. This is my East Coast time here. All right. So here you are. You've lost 90 pounds. You've overcome a long 2-year, 3-year neurologic recovery, experimenting with diet along the way, high cholesterol, and yet you're a trained nurse. You're a licensed pharmacist. A lot of, spend a lot of time working in neuroscience. So a lot of what we've learned, you're kind of following against that advice. And so how do you reconcile this, what you did and what we know with kind of, what your patients are being told, right? So this is a tough, position that we're all in where, some of our patients may not understand the nuance of everything. Maybe some of them do. And maybe they'll go research you on online, find you, and they find out that you did carnivore, and here they are, seeing you for medications and maybe asking you about diet. How do you reconcile, the paradigm, the old paradigm, the conventional paradigm, what you've learned, how you care for patients? What do you do? What do you do now?
I think it's all in context of the patient. You have to really look at the patient and what they're struggling with. Do they have allergies? Do they have autoimmune? Are they fairly healthy and they just have some weight that they need to lose? Are they struggling with food addiction disorder? Are they struggling with mental illness? What is the context of the problem points that they're having? And, you know, could this be related to intestinal permeability, which is a topic I'm extremely interested in, especially for allergy and autoimmune, in the work of Dr. Alessio Fasano that he's done on the three components that kind of go into this. And I think this is three components that actually goes into health. You have a genetic susceptibility to something, and not everything's genetic, you know, because diets follow in families. There's the triggers. So you have infections, you have environmental triggers, toxins, you have a diet, you have emotional triggers that can all impact your health and your body. And then you have that intestinal permeability and that leaky gut and what's causing that. So looking at that in context, it's you really have to take an honest look at your life and see, well, what could be contributing to all this and what can I do about this? And as far as nutrition, I think there's multiple ways that you can get a result. And the one thing I really appreciate about Dr. Ted Naiman in his book, The PE Diet, is he talks about the multiple approaches and how both sides can actually be right based on the research that we have available. And it makes sense, and I think he ties together a lot of those components. So for example, someone that has a severe neurologic injury or is dealing with a severe neurologic condition such as epilepsy, they may fare better on the PKD protocol from the Paleo Medicina group or classical ketogenic diet. Someone with stage 4 cancer, they may do better, and their macro ratios are going to be different than somebody that may just have 10 pounds that they need to lose that is metabolically healthy. A lot of people do good just simply on low carb or a paleo diet. They get a great result from that. So I think a lot of it has to do with just looking at the context of that and not getting into the dogma of, oh, this is the way you have to do it and this is the only way. And there's still a lot that's unknown. There's a lot of research that we still have to do. So I'm hopeful and optimistic that we're moving closer to that answer and figuring out, you know, what are the options that people have.
Yeah, I think I'm just really intrigued by your story, and I'm curious too, you know, because a lot of people think it's the ketones that do it. Some people think, you know, just cutting out the carbohydrates. And you're like, when you were, it sounds like you tracked your ketones through this whole thing. When you switched from the high fat to the carnivore based red meat based, basically, and eggs, did you notice a change in your ketone levels and symptoms at that time, or was it just a continuum?
My ketone levels, my blood sugar stayed stable. But I would have the spikes in the glucose, and in learning from Dr. Bickman about the gluconeogenesis, that was just my body needing to make some. So, it would be random when it would happen too. It wasn't really associated with anything. So I just attributed that to my body just needs to make some glucose. My ketones gradually trended down. They were higher because I did use MCT oil that first year, because I really wanted to make sure that I was getting that alternate fuel source. There was the work of Mary Newport with Alzheimer's. I found her stuff. So I wanted to make sure that my ketones were up kind of on that higher level to make sure that my nerves were fueled because they were damaged. So if they're not able to use glucose appropriately, or and they need to rebuild themselves, you have to be, providing that fuel source. So I was very conscious of making sure that my body was getting that fuel source. So as I became more fat adapted, and as I upped my protein and started using my body fat, taking that into account, my ketones trended down, but I've always registered ketones on the meter and had stable sugar. The other thing that was important to my recovery too was restorative sleep, because the body heals itself during sleep, and the spinal discs have no blood supply. So when you're trying to heal that and you're feeding your body the raw materials, because you also have to feed the building blocks, so the fats and the proteins, that happens through diffusion at night. So I needed to make sure I was hydrated. So I made sure I was drinking enough water, getting appropriate electrolytes, but also getting that restorative sleep So I created, didn't spend a lot of money, but I got blackout shades. I invested in a different mattress because, I wanted to make sure I was comfortable sleeping at night. I got this huge U-shaped pregnancy pillow so I could sleep with my back in neutral at night, which made a huge difference in my sleep after my back surgery that I still sleep with to this day. So sleep is also a huge component of this.
Yeah, I think
You
that's
just
one
got
of
a
the,
master class, Tro. This is a
no,
master
I mean,
class.
I think that's one of the most unrecognized things, the role of sleep. Look, if there's anything we can say here, this story just, shows people, whether it's, stroke or spinal cord injury or MS, or, that there's certainly hope and things do get better with time, and that you need to feed the body, appropriate things and remove those insults. We know that fructose harms the liver, harms the intestinal permeability. We know that, sugars, have adverse effects on the liver and intestinal permeability. We know that the body needs protein and healthy fat. We know that the body needs sleep and needs to rest. And we know that when it comes to neurologic issues, that persistence is key. I mean, you're looking at one of them. I mean, you can see it in my arm. You see the arms? You see the atrophy? Right? You're shaking your head. So I'm with you, I'm with you. The everything you're saying is valuable, and it's hopeful,
Yes,
it's hopeful.
not everybody recovers, unfortunately, and this recovery takes time. It's not an overnight process. I think a lot of people look for that overnight process, and they look for, doing exactly what I did. This was something that worked for me. I really encourage people, find what works for you in the context of your situation, and create it in a way that's sustainable. That's the other thing. I had days where, I would have, sometimes I would have food cravings for the old processed food. I would deal with, down days, everything wasn't roses. But the key was, and one thing I kept telling myself was, every moment's a chance to choose again. If I mess up in this moment, I can do better in the next moment. Don't wait until Monday. Don't wait, until the next day to start over. Just start over in the moment. You have a bad meal, start over in the moment. You didn't work out in the morning, go for a walk in the afternoon. Every moment's a chance to do something, positive for yourself. And it's just, stay the course. That's the thing, just keep picking yourself up. One way that I did that was, when I would have anxiety about something, I just do a guided meditation, which calmed my mind down. I'd go, call somebody. I would distract myself. One of the things I distracted myself was learning new skills. One way to feel empowered during my recovery was I earned a personal training certificate through NASM, because I wanted to understand how to correct my muscle imbalances, because I had one leg bigger than the other, similar to, what you just showed, Dr. Tro. And the key to that is just correcting those muscle imbalances and staying consistent. Because when you can't feel a muscle and you're not working it, it's going to atrophy. So you have to, learn ways to keep that. And you don't have to be doing all this CrossFit stuff and, all this crazy stuff. You can do it right in your home. There's a ton of body weighted exercises. There's so much on YouTube. So many, great people that are teaching things you can do. And the beauty about fitness is, if you can't do one exercise, there's another one that you can do where you feel good in the movement, your back is safe, and you're still working the same muscle. So that's really, the key for me, and what kept me, positive and uplifted, and just, continuously to go and make it sustainable in a way that a way that you enjoy and works in your lifestyle. That's the other thing.
And the thing I love about your story is that you said, okay, let me try this approach. When it plateaued out or wasn't working, let me change my approach. Let me learn. And luckily you had doctors who didn't, because I when I look at you, I think, oh my gosh, a lot of people get this diagnosis, whatever it is, cancer, whatever it is, and they just go, like, all's lost. I'm just going to start eating crappy food and enjoy what I got left. And you could have done that and lost all hope and just ate high inflammatory foods. Who knows what your outcome would have been? Obviously that's speculation, but there's no doubt you took one step at a time, and you had this determination and this positive attitude. I think having this is why I harp on this stuff, because people think it's hocus pocus, but the power of hope and that I'm going to make myself better. That's what made you go to the gym when you're 220 pounds, right? So a lot of us say, well, I'm too big, I'm not even going to go to the gym. I'm a lost cause. And I think so many people buy into that own self negativity that they never know what potential they had. Like you, I mean, you show what we could accomplish.
Yes, you never, that's one thing too, is truly finding your purpose and building the confidence within yourself to do that. So the past 5 years has been an exercise in just building my confidence. And, you know, we've had a very challenging year this year. And I think part of what's helped me, I've been working on the front lines, and I've worked with people that have been impacted by COVID-19, that have lost family members. And part of what's got me through was my recovery kind of prepared me for this. I was homebound. So, you know, I had experience just being home, not being able to go out. I learned new ways to connect with people when I wasn't able to go out, you know, because the human connection is huge. And just what I have learned from everybody in the low carb, ketogenic, paleo space, all the doctors and scientists that returned my emails, that helped me, that was a huge part of my recovery too, because it would point me in a different direction to some research or something that I might be able to apply that would work, because I was literally applying everything I thought would work for me because I had nothing to lose, because I couldn't feel my leg. And, you know, today everything's come back but 2 toes in my foot, and I'm still hopeful for those 2 toes. But, you know, my foot drop has resolved. I'm pain-free. I'm medication-free. I'm in good health, but I'm still going to keep learning and evolving. I'm not going to stay stuck in this. And that's one of the things I just feel I'm always a student. And you can learn from everybody in the space, whether you disagree or agree with them. I think everyone has very interesting commentary.
Yeah, that's true. You know, and I think that's the point. If we respectfully say, let me reassess, because stuff I thought was crazy a year ago, now I look at the data and say, well, maybe they're onto something. And I think if we give that up, we've lost all hope, and you know, we're not gonna be able to help that person, because who knows, if you would have went carnivore from day one, how would your recovery be different than having the high fat then switching over? But you know, I believe that sometimes we're our own better judge of how we're responding, rather than what Tro says or I say. It's like, let me try it, and if it doesn't work, let me try something else. And the crazy thing is, every day I hear this is non-sustainable, and you're talking about this sustainability you did for all these years. Tro, I know myself, and I know my patients. And so when people say this is non-sustainable, so not even try, makes me crazy. Like, try it, and if it's not sustainable, we'll figure it out and we'll switch to something else. Like, liquid diet is non-sustainable. All these things that they're recommending, like in the NHS and stuff, you look and say, I know for a fact that's non-sustainable. We all know that. But you're recommending that because you say, well, you can lose weight quickly. Yeah, but you're going to gain it back within 6 months. I have not yet in my practice in all these years and doing what I do now, seen one person sustain weight loss with liquid diet. Just have not seen it. I personally haven't seen it. I'm sure it's happened. I'm sure there's someone's going to say, bring me on the show and I'll talk about it. But I haven't seen it. I've seen a roller coaster ride, and I've seen more weight gain than when they started, you know, over time. So what you're talking about is so pertinent and so important.
Yes, and meals can be so simple too. I didn't do complex recipes. I just, you know, foods I could eat, I just put it together in a way that I liked it. So it doesn't have to be, you know, complex. And I think people have the danger of comparison, is you always think, oh, I'm doing this wrong. Trust your body, trust what it's telling you, and trust the results that you're getting. And develop it around, you know, whether it's your work schedule, if you have to meal prep a little bit, you know, because it ends up giving you time freedom. Because the other thing is, I became a minimalist during this. I discovered the minimalist because I had a lot of time to watch YouTube when I was homebound, and I decluttered my environment. I set my environment up, you know, for success. I had a lot of clutter in my home, and I, you know, cleaned all that out. I cleaned out my kitchen, and, you know, put foods in there. I got rid of foods that I might have been tempted by. And I just set myself up for success in my environment. I spend 10 minutes a week dusting and vacuuming now. I don't have anything in my home that I don't love or I don't use. You know, I just keep it really, really simple. And that's just, you know, what things I do. If I'm tempted by something, you know, a sabotaging behavior, I'll go out for a walk, or I'll work on one of the skills that I'm learning. Because one of the ways that I feed my brain and I feed that reward center is I do something I enjoy. So if I feel down or I feel like I'm gonna have a sabotaging behavior, because during this time, I honestly, like, I was craving chocolate cake. I was craving stuff. And I'm like, this is because I feel down this year. You know, it's a lot of people are struggling, you know, with their mental health. People that have never been depressed before feel depressed. And part of that, I was, you know, craving foods that were not natural to me that I hadn't craved in years. And I told myself I can still find joy in my daily life by learning a new skill. So I would go and I would practice that skill, and that brought me joy. Or I'd just go out for a walk, or I'd go down to the beach and, you know, go for a walk, and stuff like that. Or just, you know, Skype with one of my friends just to have that type of connection. So there's always a way. It's just you have to find solutions that are going to work for you, because everyone is different.
Absolutely. I agree. I can't agree more. This was absolutely amazing, inspirational, and amazing. Thank you so much, Dr. David Gray. Sorry, Dr. Nevada Gray.
Like, did I miss something here?
No, yeah. It's me not having enough coffee in the morning. Thank you so much for coming and sharing your story. You will reach people. The story of hope will reach people. The story of going against the grain. And the story of somebody, you know, just like us, Brian and myself, who, you know, we have to deal with patients on a day-to-day basis, and we have to reconcile what we've learned with what we have been saying. And so thank you for everything, being a patient advocate, you know, along the way.
Yes, thank you for having me on, and thank you for everything you guys are doing, because there's so many people looking for doctors like you. And, you know, thank you for furthering this research and provider education. I appreciate everything you guys are doing as well.
No, we appreciate it, because we couldn't do it without guests like you, because we learn every time. We learn, and people get mad at us for asking so many questions sometimes, but we want to learn so we can go back and help our patients. You know, it's not really a popularity contest. It's about being a better doctor and a better person. My closing question for you is, like, every day when you're walking and exercising, do you still appreciate walking and being able to pee on your own and all those things that none of us really think about?
Yes, everything. If you have being able to take a shower every day, or, you know, just even being able to go to the bathroom normally, where your whole world revolves around where's the bathroom, is there going to be stairs, or is, you know, am I going to be able to get into a place where I'm going? Is there a handicap? You know, is it handicap? Is there a railing, you know, in the bathroom? Like, all these things that you would never think about. So I exercise every day. I do exercise I enjoy. I don't, you know, this isn't work for me. This is something I truly enjoy. And I'm just so grateful to be able to move my body, because when that's taken away from you and you can't do it, and then you have it back, you never take it for granted. You never take it for granted. And you never take feeling good for granted too, because when you felt bad, when you feel good, you just never take that for granted. And I'm just so grateful. And that's, you know, one thing that I put in my life every day. I have a little notebook, and I always center myself by what am I grateful for? You know, there's a lot that's going on in the world. People are losing a lot, you know, their homes, their jobs. And, you know, I just always tell my patients, do something every day that brings you joy. Focus on what you can do versus what you can't. If you're, you know, there are people that have reached out to me this year that have had to have emergency back surgery during this pandemic for Cauda Equina Syndrome. And I always tell them, focus on what you can do versus what you can't. Focus on what you can recover. Don't focus, you know, so much on what you've lost. Focus on what's ahead and what you can recover.
Words of wisdom. I think that is so critical. And in closing, you know, these hours go by so fast, because I love every second of this. And there's so much wisdom and knowledge. People are going to want to listen to this a bunch of times. And I think counting your blessings, be grateful, because I see a lot of people who aren't grateful. Trust me, I've been all over the world, and I've seen people who are grateful for everything they got, right? So I think in America, that's one of our downfalls, is that we have so much that we're ungrateful. We can have what we want tomorrow by Amazon. If it takes 2 days, we get upset, right? So those are great words of wisdom that you're giving. It's like, hey, look, count your blessings. If you can get out of bed, if you can go to the gym, get your butt over there, you know, and inspire someone else. And we've seen that. So I love people like you coming on and telling your journey, because you've had quite a journey. It's amazing. Tro, do you want to close us, man?
No, this has been a pleasure, and thank you so much for coming on. It's tough sharing, you know, your own medical journey, and it's a, you know, it's a piece of your private life that you share with everybody so that they can benefit. And thank you for doing it, and thank you for everything that you do. And I know it's a challenge to get on here. You're a pharmacist, and you know, people are going to listen and they're going to hear these controversial topics like LDL and cholesterol and keto and carnivore, but it'll at least get them asking important questions. So we appreciate everything you're doing.
Thank you.
All right, everyone. Thank you for joining us. Thank you for sticking it out with us. This is a great episode. I've really loved it. So Nevada, thank you so much, and for all you're doing, and how you're going to inspire and continue to, and count your blessings this week, all.